Yeah. So, obviously, healthy brain is necessary for all activities of daily living. So it goes without saying that, maintaining brain health is essential for any other activity. So you may have, you may find a drug that will prevent heart attacks, all right? But then if you get demented, you know, your heart attack is not going to be giving you a full life. You really still need a full a working brain for as long as possible in order to maintain, a life that is engaged and allows us to interact with our neighbors and our families and so on. So that is critically important. And so brain health, maintaining brain health requires a convergence of medical and societal efforts that need to kind of be work together to allow us to maintain brain health. So and is mainly directed along the lines of prevention through a lifestyle that is conducive to maintaining and promoting brain health, which is a major aspect, as well as medical support and treatments, if in case of chronic conditions which may have an impact on brain health. And then finally, there may be therapeutic interventions for conditions that are targeting brain health selectively, for example, stroke and dementia, Alzheimer's disease, frontotemporal dementia, and other conditions that target the brain directly, even though you may have a great lifestyle, you may still have some disease affecting brain health that requires a targeted therapeutic intervention. So those is kind of the landscape of brain health that we need to kind of try to preserve. I think that's one of the primary duties of practitioners, particularly in a community, to drill down on the patients, the importance of maintaining brain health. Now, in a general population, what kind of things would you want to, highlight? For example, the big one is blood pressure control. Maintaining blood pressure is critically, important for maintaining brain health. Over the past, 60 years, there has been a dramatic reduction in mortality for stroke and heart attacks. And most epidemiological, leaders, attribute this reduction in great part to controlling blood pressure. So there is no question that controlling blood pressure allows us to live longer and to live more meaningful life. So that's blood pressure is a big one. All right, it's a big one. Should it be a chronic disease that affects in a long-term brain health, like for example diabetes or cardiovascular diseases, like having, atherosclerosis or heart problems and so on. Those diseases, in the long run will impact the brain in a negative way. So maintaining the health of those organs is going to be very, very important to maintain brain health indirectly, all right? And a healthy lifestyle, not smoking, either cigarettes, electronic or not, not abolishing that habit. And, the diet is profoundly important. And there is it's been shown that the Mediterranean diet, avoiding, fat, avoiding, animal fat, and avoiding excessive, caloric eating and, refined sugars and excessive salt, particularly in processed food. All of this kind of dietary interventions, are also very much beneficial on the brain as well as in other organs, and exercise obviously has come out as one of the major good, things you could do to maintain the health of the cardiovascular system, but also of the brain. So studies show that the people who exercise, tend to have a better memory retention and also brain functions and so on. So that kind of, finally, I guess when you're talking about perhaps the older population, who, let's say, retired population, social engagement, and as well as effort to stimulate the brain, the intellectual activity of the brain. For example, playing a musical instrument, or crossword puzzles, or any other activities that they kind of keeps our brain thinking and engages our our challenges, our existing intellectual levels, will be very, very beneficial. And also interaction with others, like community centers, and, for seniors, and obviously, ideally, family interaction, those are kind of some of the most effective way to preserve brain health. And a number of studies, throughout the world have shown that if you do one of these 4 or 5 things, you may get a little bit of an advantage, but the best advantage when you do them all together. So when you exercise, stimulate your intellectual skills, you have a relational interaction with your family, you take good care of yourself, blood pressure, everything. So what works best is when all of these factors, are implemented together, as opposed to having, we'll take care of the blood pressure, but not diabetes, you know what I mean? That kind of stuff. And even beyond the medical treatments and preventive strategies, also the other aspects like exercise and social interaction seems to be, working, all together to amplify the beneficial effects.